On behalf of the Critical South Asia Group at Warwick, the Warwick Interdisciplinary Center for International Development, and the School of Oriental and African Studies Development Studies program, I welcome you all to this public meeting. As we gather here on this online platform to talk, to listen, and to share our analysis and experiences of the devastating effects of the second wave of the coronavirus pandemic in India over the last 1 month and before, I want to take a moment to express solidarity with the Palestinian people, whose already fragile infrastructure of health is once again under relentless attack. As Palestinians of all ages are being dispossessed and bombed, we wish to extend support to the resistance of the Palestinian people and to all those in solidarity with them. We also want to acknowledge and offer our respect to all those who lost their lives to the pandemic in India and elsewhere, as also to acknowledge the suffering and loss that many, if not all of us, who have joined in today have suffered. In the midst of all this suffering and an ongoing health emergency, we decided to organize a public meeting because it seemed that it was equally important to participate in conversations now. The COVID pandemic in India, as elsewhere, has revealed more starkly than ever before how closely health and politics are tied together. We decided to organize this meeting both to understand those links so that we can better forge the long process of healing, reconstruction, and rebuilding of the social and political devastation that has been caused by a state that has been remarkable by its absence. That absence has been filled by ordinary citizens, neighbors, cremation workers, doctors and nurses, food delivery workers, conscientious administrators, and carers of all stripes. Today, we want to take the opportunity to do our small bit from afar by launching a Warwick Emergency COVID India fundraiser aimed specifically at organizations working in rural and non-metropolitan areas. A dedicated group of activists on the ground in India and researchers here at Warwick has vetted each of these organizations. This drive is to solicit contributions from people outside India. We will be posting the link in the chat as we go along, and at the end of the meeting, the organizers will be on hand to answer any questions that you may have. Please also feel free to post your questions in the chat and to share the fundraising drive on social media, among your circles, and of course to contribute by hitting the donate button. Without further ado then, I want to hand over the proceeding to my colleague, Dr. Shrikant Botre, with whom I will be co-chairing the meeting.
Thank you, Rashmi. I'll just add one thing to the instructions given by Rashmi, that we have in all 12 participants who would be presenting. And therefore, we have decided to keep our speakers' introductions very, very short, because this will give us more time to discuss about the issues in the latter half of the meeting. So to begin with, our first speaker is Murad Banaji. He is a senior lecturer in mathematics at the Middlesex University, London. Murad is someone who is studying the COVID situation in India since the beginning of the pandemic. He has written extensively on mathematical modeling, and particularly on why mathematical modeling plays an important role in understanding the spread of the pandemic. What are the problems in knowing exact numbers of infections and deaths? And what are the similarities and differences in the COVID data that we come across from different states of India? He'll be talking to us about the statistics of COVID. Murad.
Hi, thank you. And thank you for inviting me to speak here. I hope you can hear me. Good. It's a very unenviable task. I've got 5 minutes. I'm the first speaker, and we're talking about COVID in India, a hugely difficult topic to talk about. But I think I'm going to assume that people understand the scale of the devastation, and maybe that some of our later speakers will talk about the scale of the devastation that's occurring, so that I can kind of focus maybe on rewinding a little bit and trying to come to an understanding of how we came to this point. So I've been tracking the epidemic from very early days, and it's not been easy. I think that's the first thing to say. It's not easy because the data that you have to use to try to track an epidemic like this is often very, very limited. There's two reasons why the data is limited. One is that the kind of systems and structures by which data is being gathered are kind of sometimes inadequate. But another reason why the data that you can use to try to track an epidemic like this is limited is because of what we can call deliberate dishonesty and data fudging, which has become very, very widespread. Or rather, I should say it's been fairly widespread right from the early days. So we've got two kind of overlapping difficulties in understanding the Indian epidemic. What this does is it makes it very hard to disentangle what's going on in terms of epidemiology, in terms of the virus, and what's going on in terms of politics. The two overlap in a very kind of essential way, because we get little pieces of information which are partial and often sometimes incorrect as well, and we have to try to infer what's going to happen next on the basis of that. So I feel this has been kind of one of the huge challenges of trying to understand India's epidemic. Anyway, let me rewind a little bit and let me say briefly what the kind of trajectory has been. So I think we all know that disease started to spread around February to March, a lot of it under the radar in those early months across the country. And by late March, you had a national lockdown. And one of the controversial and difficult questions is to understand what the effects of that national lockdown were. We understand that, of course, it caused huge misery and devastation. You had the migrant worker crisis. You had people who were kind of trying to get home, walking literally thousands of kilometers along highways. So you had that aspect of it, but also you have to ask, well, what did it do to disease? And I think it did a complex mixture of things. We found that disease continued to spread very fast in the urban slums. That's one of the things that lots of different bits of data tell us. We found that it was slowed but not halted in urban non-slum areas. So it still spread in building societies in non-slum areas of cities. And probably, if you can talk about one success of the lockdown, one positive thing, disease was kept to fairly limited numbers in rural areas. So that you can say was probably one of the things that came out of national lockdown, although at a huge cost. Of course, that lockdown was not sustainable. It was a series of lockdowns, and as they eased, you had people going back to rural areas, including migrant workers, and many of them, of course, coming from the slums where disease was raging. And of course, disease spread to rural areas during that period of time. So you entered another phase where you still had lots of restrictions in place. You still had the disease slowed by national lockdown, but it was spreading much, much more widely. And also, one of the things which had happened was you had different things going on in different states, but then gradually, as you had opening up, you started to see spread basically across all states, some coming in later than others, but you essentially saw a national epidemic instead of a series of local epidemics. So that's one of the changes which happened. As you had the kind of later part of the year, as you went into September, October, November, the last part of 2020, you started to see things winding down at the national level, but actually that winding down of cases and in deaths that you saw happening at the national level hid another story, which is that you continued to have spread in rural areas. We know this because there were serosurveys done, which found that there was a very large jump in spread in rural areas towards the end of the year. So actually the data that you see coming out, the case and death data, actually often hides a more complicated picture because some regions are much better surveilled. We know what's going on because they're kind of testing quite well and deaths are being picked up. And then there are parts of the country where surveillance is extremely poor. Anyway, we come to the point then where you have this kind of pause between the two waves. You have a second wave approaching. We don't yet know it at that point. And you have all sorts of narratives, which I won't go into because they're too kind of long to go into, but you have all sorts of narratives which are both contradictory and wrong about how India is past the worst. You have this huge complacency developing. You have big religious gatherings. You have long drawn out elections. you have an achingly slow vaccination drive precisely because it seems that nobody up on high seems to be anticipating that there's a new wave coming. Even once the data starts to come, so by mid-February, it's very clear that you've got something going on. By early March, it's intensely clear to anyone watching the data that you've got a new wave and it could be devastating, and it's coming our way, and many people are writing about it by this point. And at this point, you still have the health minister, for example, saying that we have beaten COVID, that, you know, COVID is kind of over. And you have government-aligned modelers saying the same thing. That's another long story I won't go into, but you have people who are supposedly scientists backing up this patently incorrect narrative. And I think I'll leave kind of the rest of maybe what I hope to say to questions, because I want to really stick to my 5 minutes. But what I do want to say is that the huge data gaps combined with people being prepared to be on message without actually looking at the data. So, you know, just kind of scientific people who are supposedly part of India's scientific community backing up a message which is not credible and is at odds with the data, I think have led us to this point of huge devastation that we're seeing at the moment. I think I'll stop there.
Thank you, Murad, for your wonderful presentation. Our next speaker is part of the state administration in Maharashtra. He's a collector of the Nandurbar district, which is also known as the tribal belt of northern Maharashtra. Rajendra is known to many of us as someone who has made Nandurbar a self-sufficient unit in terms of oxygen production. However, besides this, he himself belongs to the tribal community, and his administrative skills and his command over the local Irani and Bhili language has allowed him to manage the pandemic in a better way. So, Rajendra, please go ahead and make your comments.
Is Dr. Bharud here?
Yeah, he's here.
Yeah. If you can unmute yourself.
Can you unmute yourself, Rajendra?
Sorry, all I need to ask him to unmute himself. I'm just finding him now.
Yeah.
Yeah. I hope I'm audible now.
Yes, we can hear you.
So first of all, thank you, Srikant ji. Thank you, Rashmi ji. I was in the midst of meeting, so I joined late. But if you permit me, I can share presentation for 5 minutes. If is it okay?
Yes.
Absolutely.
So host disabled participant screen sharing. So I again request, please allow me.
Okay. Jayanti, can we do that?
I've just done that, Rajendra ji. Please carry on.
Oh, okay. Thank you so much. So basically, I think it will be much better if I explain on the presentation screen sharing. I think it's view now. You can view the screen.
Yes.
Yes.
You can see the screen. Yeah. So Nandurbar district is a tribal district. We have 6 blocks. Current population is around 2 million, and 70% population is tribal. In terms of Human Development Index, is the poorest district. You can imagine for the 2 million population in government setup, we had only 2 MD medicine doctor. There is no medical college, no BAMS college, no BHMS college. And because of the hilly terrain of Satpura, a lot of issues of health issues were there. So we have only 1 district hospital, 2 SDH, 12 rural hospital. But when COVID started, 90% government hospital were already occupied by the regular patients like deliveries, cesareans, fever, malaria, typhoid. So it's very difficult for us to convert this regular hospital into the COVID hospital. So these were the issues. We were not having proper health infrastructure, no medical college, no RT-PCR testing lab, no oxygen plant. Around 35% government vacancy was there in the rural health setup. Hilly terrain, people were illiterate. It's the most illiterate district in the entire Maharashtra. So first thing we set up our district control room. Initially, people were calling for a small reason to district collector. So first thing, this call actually, that frequency of call got reduced, and every day around 50 to 60 calls will directly go to the control room. They will note it down their problems, and they will try to give the solution. And if some issues comes out, like about RT-PCR test, about availability of beds, then we had developed this dashboard. So this had taken in around 15-20 days back. At that time, 217 oxygen beds were available in 24 hospitals. Currently, more than 600 beds are vacant, oxygen beds. So in this dashboard, everyone can see block-wise, hospital-wise, which type of bed they want, ICU bed, oxygen bed, which type of ambulance they want, which vaccination booth they want. And in fact, High Court of Mumbai actually praised about Nandurbar dashboard system, because every hour, which hospital has how many beds vacant, that data gets automatically reflected. So this is the current scenario. In government setup, we have 258 beds in civil hospital. In periphery blocks, we have 161 beds. And in the entire setup, like in railway, rural CCC, total beds, we have around 6,700. And in private hospital, 902 oxygen ICU beds we started. So this is the current situation. Many beds were lying vacant, and people, because the caseload that we got in the month of April, in the first week, we are getting around 1,200 to 1,300 cases per day. Now the caseload is reduced since last 15-20 days, around 60 to 70 cases are coming per day. So how we had able to decrease that caseload? We had used this technique of using RT-PCR swab collection by going door to door. You can see the tribal woman who is staying in the village. So instead of she coming to our laboratory or our swab collection center, our teams will go to their door-to-door step. So around 16 teams were deployed for the door-to-door collection. Along with that, we had put our own centers which will collect the swab when people are coming to our hospitals. And along with that, around 29 mobile teams for rapid antigen collection we had put. So this was the situation a few days back, where 36,000 cases out of this 699 people were died. And in that entire scenario, around 1,000 patients who were detected and treated, which were outside of Nandurbar district. They came from Madhya Pradesh, Gujarat, Nasik, Jalgaon. So neighboring district people also started coming in Nandurbar because we have so many beds vacant. So these 200 contractual persons we recruited, health personnel, because we were having the shortage of the doctors and nurses. 86 contractual person done only for the vaccination and CCCs, because we were not getting any MBBS or MD doctors. We trained BAMS, BUMS doctors for the intubation, for the intensive practices. So this was the woman dedicated hospital we made of 250 beds, where only women patients will be treated, so that they will feel more secure. So doctor, nurses, everybody will be leading. This is oxygen facility where a lot of people were praising about that. So 3 government oxygen units we have set up, and 2 private units, like total 5 units. 4 more units are in under establishment, under constructions. So every unit will start 600 liter per minute. So if you combine the capacity of entire all the 4-5 units, it will come around 48 lakh liter per day. And at the same time, we got some concentrators also. So basically, those who are in the remote areas, we are using the concentrators which are in the hilly terrains. So my motive was that every hospital of government setup, all RH, all SD should have some oxygen beds. And the people, instead of coming to the district, they should able to take treatment in their own area. This oxygen nurse pattern, which was praised by the health minister and the Niti Aayog, where we had put dedicated nurse only for monitoring oxygen, to reduce the oxygen, to increase the oxygen for all 50 patients in one hospital. The work only is the same work. Every hours, every patient's oxygen will be checked out. So by that, we are saving a lot of oxygen. Oxygen audit of all the hospitals has been done. This was the railway, which experiment was done in Nandurbar. In the summer region, you can see those jute bags, which were kept on the rooftop, and water coolers, small water coolers kept on this window side. So that temperature, which was very hot, more than 40 to 43 degrees Celsius, but because of all this Indian jugaad system, we were able to reduce the temperature by more than 15 degree. And I just said, in the Nandurbar, to put patient on the home isolation is extremely difficult. Many times that patient can transmit the virus to so many other people. So because of this isolation facilities, we were able to cut down the transmission, and we were able to reduce the per day caseload from 1,200 to less than 100. This was the dedicated women hospital. These were the ambulances. So as I said, we were having a lot of issues of vehicles also, ambulances also. So we got till date, we got 42 ambulances from different sources, out of which 28 ambulances we got from CSR, others we got from government. So because of these ambulances, not a single complaint, because all ambulances are GPS tagged, they're properly monitored. If anybody got some issues, they will call the control room, and ambulance driver, instead of patient coming to the hospital, ambulance driver will go to the hospital and they will pick the patient. Similarly, vaccination as a tribal bed is a very big challenge for me, because people were very apprehensive, fearful. They were not ready to take the vaccines. So instead of people coming to the vaccination center, we deployed 17 school buses, 16 vaccination teams, and they will go village to village. They will take the camps there, because to register in the COVID app is a very difficult thing. So our teachers, our headmasters, ASHA workers, ANM, they will help them to do the registration. And because of that, right now more than 210,000 doses were administered to the villagers. This is the graph that I was explaining. By 5th of May, the target from case load of 1160 to 1200, it gone to 240. Currently, since last 10 days, it is coming by 50, 60 or less than 70. And this is how the death rate also reduced from 13.33 in the last May 20 to it's now less than 1.70. And this is the infrastructure that we were able to develop. RT-PCR, now we were having 0 initially in the April 2020. In April 2021, we have 2. Oxygen beds were only 20, now 278 oxygen beds. ICU beds were 0, now 60. And I am not explaining about the private setup. Its private setup is completely different.
Rajendra, I'm so sorry to interrupt. This is fascinating. We're so tight on time. I wonder if you're able to wrap up, and then we can come back in
just one slide. Then I'm finishing the presentation. Wonderful. Isolation beds numbers, I had put on more than 7,000 isolation beds, 57 ambulances. We were having only 2 MD doctors initially. By motivating people, 4 MD doctors came. Similarly, other health infrastructure. And this is the conclusion: everyday follow-up, setting up the target, proper SOP, pulling up resources, manpower training, building up testing facilities, strengthening health infrastructure, and creating awareness using mainstream media. So thank you very much for giving me the opportunity. I'm ending my presentation here.
Yeah.
Thank you.
Thanks, Rajendra, for explaining the challenges that you faced and the ways in which you combated the pandemic.
Thank you.
Okay. Our next speaker is Vishnu, and I think it's going to take him a little while to join us.
Okay.
So should we go on to...
So should we go on to the next one? Yeah. Okay, so the next speaker is Suraj Telange. Suraj is a PhD candidate from the Department of Development Studies at SOAS. He works on labor processes and the e-commerce shop floor management in India. He will be talking to us about the COVID realities in rural Maharashtra and India. Suraj himself comes from the rural parts of Eastern Maharashtra and is currently working from India. Suraj.
Hi, can everyone hear me?
Yeah.
Okay. I can't seem to see myself, but anyway, that's okay. So, yeah. Hi, everybody. I don't have electricity right now because there was a storm just half an hour before. But yeah, I'm going to share 3 stories that I have got from my village. So this is eastern part of India. It's basically central, but eastern part of Maharashtra, more towards the side of Chhattisgarh and other places. So the first story I got, it's about a Shantabai, an agriculture laborer who works along with my mother and father in a labor gang. So last week of April, she was like ill. So we didn't have anything to test her. So people thought, okay, she's ill, so she might be COVID positive. And the place she lives in, it's a 16 years old tin shed where people were resettled during the displacement project of a dam. And then where she was kind of in quarantine. So she was quarantined for 5-6 days, and after 5-6 days, she comes back to my father and asking whether she can join the work again. And my father kind of says, yes. I looked at him and I asked, but she's still ill. So my father tells me, oh, but what will she eat? Because we can only give food to these people 5-6 days, but not more than that. So what really happens when it comes to quarantining the people who might or might not have COVID, because you don't know, because you don't have testing capacity around here in down villages. So they get quarantined and then they are left to feed for themselves, for which they don't have any accumulated resources. Even like, almost all the people around happen to be kind of daily agricultural labor wage workers. So that really stresses them out. And also they have to kind of, come back and say, okay, I want to work, because if I don't work, I just don't have enough money to purchase a food and I might just die because of hunger. So that's the story of Shantabai. Then the next story I have, it's about fetching a milk that my mother used to do when I fell ill. So I was ill for some 5-6 days, but it was just illness of something else. But then my mother used to go and fetch a milk, because we don't generally have a milk at home. So she started getting milk for me. So she used to go to the OBC household. OBC is other backward classes in Indian kind of caste system. So she used to go and fetch a milk from that particular household. So one day she went in the morning and then she comes back to my kind of bed, and then she says me, oh, Suraj, I'm not going to fetch milk for you from tomorrow onwards. I'm like, okay. But then she asked me, why? You won't ask? I'm like, yes, tell me why. Then she says, I don't like to be being treated untouchable. I'm like, okay. Then she narrates this experience of, when she went to that particular OBC household, that particular man told her not to come inside. So basically asking her to stay away. But idea of, him asking of, staying her outside, not necessarily comes from that caste prejudice that he might have, but the experience that she feels, it reminds her of own ostracization in her historical kind of being, that necessarily re-traumatizes her and reinforces the caste biases that we have kind of seen in Indian kind of scenario. So we really need to be careful when we talk about the social distancing and those things, because it has a tremendous potential of victimizing and re-traumatizing the people who have had kind of experiences of life where they never have been treated with dignity. So that's second story. The third story is I have about the vaccination. This is very remote part of the Yavatmal district, is one of the kind of poorest districts in Maharashtra, state of Maharashtra. So what happens to the vaccination program that apparently appears to be kind of objective, because it's COVID and everybody's kind of just go on the computer and you get the registration and you're done, because it's fairer, objective. The system brings that logic of it bearing it's kind of giving you that objectivity sense. But what really happens down to the villages, where systems have always been manipulated in favor of upper caste and upper classes in India. So the point of kind of the experience that I had like with vaccination. So I wanted to get my mother and father vaccinated, and that was kind of during the month of April. So at the beginning, and then I started going to nearby primary healthcare centers. So we have like one from like another district, which is Amravati, which is like border. My village is a border to Yavatmal and Amravati district. So we have like nearest PSC, what we call primary healthcare center, is in Amravati district. So I started going there and asking, okay, when can I bring my mother and father for vaccination? Every time I will go, they will say, oh, there is no supply and we can't do anything. But then you will also see other people coming on a particular time and getting vaccinated. I wondered, okay, what is this mechanism of like particular people knowing it like automatically? And then after continuous 8 to 9 days, like fetching continuously and going and negotiating with that person who manages that vaccine, I realized, oh, it's not easy. It basically means who you are, what you are, and what kind of social capital you have in a kind of rural society. So what my supervisor and like his co-researcher always talks about conjugated operation. So it kind of works in the simultaneous fashion down here when it comes to the vaccination. So I went and then kind of I used my all so-called kind of whatever little social capital I got, kind of going to kind of London and like having so-called very admirable language to speak. I spoke to him and I told him, see, I need vaccination for my mother and father. And then he realized, oh, I'm not someone, quote unquote, some laborer, some illiterate man. I'm someone who has a knowledge of certain things. That little capital allowed me to bargain and play into the game which eventually kind of, led my mother and father to getting a vaccine. But the sad story of it doesn't allow a laborer or simple kind of, daily people going to the farm and working and, earning their survival every day. So they wouldn't ever come to know who is being vaccinated when there is a supply. When there is a like short supply, who gets affected? It's almost always Dalits, tribals, Adivasis, and those people. And they continuously kind of, have this kind of, social network mediating this so-called objective systems. So this was my third story. I'm still left with time. I have another story.
Your time is up, but thank you so much.
Thank you, Suraj, for sharing those stories that have thrown light on how caste has shaped the behavior of people during the pandemic times. So,
okay, I'm not sure Vishnu has made it yet,
okay.
But we do have Abhay Mohan Jha with us. So I would like to invite Abhay to come and speak. Abhay Mohan Jha is a lawyer by training, a farmer by practice, and also a freelance journalist. He is based in Betia in Bihar, and Abhay will talk to us about what is happening on the ground where he is. Abhay, if you can unmute yourself, please.
Abhay should be unmuted, Rashmi.
Okay, Abhay, can you hear me? Can you hear us? Okay, let me just check with him. While I'm checking, should we go on to our next speaker, Mathew Varghese?
Yes.
Okay.
The next speaker is Mathew Vargas. Mathew is an assistant professor at the School of International Relations and Politics in the Mahatma Gandhi University in Kerala. His work focuses on the politics of urban ecologies, anthropologies of poverty, and the languages of development. In particular, Mathew is interested in unpacking the relationships between the urban and the peripheries of the urban. Today, he will be talking to us about the COVID situation in Kerala. Mathew. Can we?
He's having to use someone else's.
Okay, I see.
Rachel Varghese.
Okay. Mathew, you should have received a request. Great.
Yep. Hello.
Yeah.
So, am I audible?
Yes. Please go.
All right. Thank you. There were some delays in signing in. Some system was keeping me off. Thank you. And sorry that I missed the initial part. And many of it were very embodied stories, which are significant and which should have been followed. I come out with a perspective which is basically going in two ways. One is the backdrop to where I'm from, namely Kerala state. And second is what is it getting extended to in the second wave specifically as it looks. So there was an initial phase and there was no real break in the corona pandemic, though we see it as waves, but the initial phase was building up here, at least on a backdrop of a planning process, which is like 2017-22 planning process, which was a major upgradation of public health sector, many of which might be very familiar to you, the primary to taluk district medical colleges system, as well as the tertiary centers expertise were put in place mostly during the Nipah virus outbreak. And after 2010, there was a major problem in the public healthcare system. And in 2016 onwards, there has been a modernization program, so to say, a pre-pandemic innovation, if I may see it in another way, for the registry of respiratory diseases as a big problem itself. So that meant there could be a ready conversion of the present COVID-19 and look out for like community transmissions, which in a way helped the whole process. So there was a second phase of a decentralized planning, which was already ongoing in the state, at least in the health sector specifically. So you might be also familiar with the initial phase of this trace track quarantine phase, and the health system looked like pretty functional in that level by employing the control and the reduction of fatalities to a great extent, coupled with what is very special was the community kitchens that were running during that program, which is operational during the floods as well. So the local bodies as well as the communities came together, especially with a gender dimension, that the Kudumbashree, which is a community-driven agency, people by very efficient networked female members, became a major backbone for an intervention during the flood as well as later in the corona case. But the second wave was something different. It had major challenges, and challenges are huge, though especially with the second wave, the variants, higher percentage of aged people becoming more significant, comorbidities, all kinds of things, plus the way in which it had already hit the retailers, small traders, which becomes a significant part of the Kerala socio-economic life. A huge number are in it. And that overburdened the health system to a great extent. And the returnee migrants, again, a backbone of the state, they were already here, they couldn't go back, and all in the context of controls and lockdowns were getting exaggerated. Now, it is in this context that that another system was put in place in the last couple of months, one of which is exemplified by the oxygen audit committees, which is again put in operation by deploying this available oxygen in a state of efficient usage, and also a major exploration of this going together with other bodies like the BPCL, Bharat Petroleum, to which ironically the center was all set to disinvest, in fact, but the state had set up hospital beds where oxygen supply is readily available. So this was upgraded to a number of hospital beds, not just for oxygens, but also for an immediate care facility. Coupled with that is the nursing professionals who played a major role, and still the effect is to be known, and we are in the middle of it, but this 72 lakh vaccines which were available, in fact, they converted into 73 lakh, which is basically using the extra vaccine in the vials which are there, which was made use of. So these are some examples in which, coupled with, for example, the mental interventions like Ottekella Oppamundu. You are not alone, we are with you. That's 1,079 personnel deployed for a backup. Now, what I want to conclude is this is in the middle of a process. But if I look at the system, there is a way in which a social contract with welfarist expectations, not welfare state, no, but a welfarist expectation has been shaped in Kerala. This is not a relationship of benevolence, but of rightful entitlement. So it is also a fact that there are increasing strains because of the limitations of individual states within a centrist system. But during times of less caseload, and when medical advices for controls are relaxed, there is always another problem that people expect a lot from the state as well because of this welfarist expectation. So there is a consequence of a historically particular structuring of public sphere that translate into a prolonged political engagement. And during pandemic times, it is taking novel forms, as you see it on the ground. So this is what I would like to put in a nutshell. Yeah. Thank you.
Thanks, Mathew, for your thought-provoking presentation. Should we go
Yes, I think Vishnu has been able to join. Yeah. Yes, thank you, Mathew, for that, very strong case that you made, for what is happening on the ground in Kerala. Could we please unmute Vishnu Narayan?
Vishnu, you've been asked to unmute. You just need to accept it. It might take a couple of seconds. Great.
Okay, so I'll just introduce Vishnu very briefly. Vishnu Narayan is an independent journalist who writes on social and economic issues in rural Bihar, traveling between the state capital Patna and his native village in Kaimur. Previously with India Today, Vishnu now runs the platform The Bihar Mail. Yes, Vishnu.
क्या हिंदी में बोलना सही होगा या सारे लोग समझ जाएंगे, या मैं अपनी जैसे भी टूटी फूटी इंग्लिश है उसमें ही बोलने की कोशिश करूं? आप बताइए।
जो ज्यादा आप हिंदी में भी
अगर आप चाहिए तो हम अनुवाद भी कर सकते हैं।
अनुवाद कर लेंगे। हाँ।
नहीं, ठीक है, तो फिर मैं हिंदी में बोलना शुरू करता हूँ। दरअसल जहाँ से भी हम आपसे बात कर रहे हैं वो कैमूर जिला है, और कैमूर जिला एक तरीके से एक तरफ झारखंड से भी बॉर्डर शेयर करता है और दूसरी तरफ उत्तर प्रदेश में भी कई एक अलग अलग जगहों पर बॉर्डर शेयर करता है।
I'm talking to you from Kaimur district, which shares a border with Jharkhand on the one side and Uttar Pradesh on the other side.
जी, तो the thing is कि ग्राउंड पर जिस तरीके की चीजें दिखाई पड़ रही हैं, और ग्राउंड पर बहुत सारी आप अलग अलग तरीके से रिपोर्ट्स देख रहे होंगे। हम सभी लोग जो है इंटरनेट के माध्यम से एक दूसरे से अलग अलग जगहों पर होने के बावजूद भी संवाद कर पा रहे हैं, मगर कोविड की पूरी क्राइसिस के बीच जिस तरीके से ऑक्सीजन का क्राइसिस देखा गया, और अब कोविड के वैक्सीन को लेकर के एक चारों तरफ मारामारी की स्थिति दिखाई पड़ रही है, मगर अभी भी जो ग्रामीण इलाकों की बात करें, जो रूरल इलाकों की बात करें, तो जो फर्स्ट डोज ऑफ वैक्सीन शुरू हुई है 18+ के लोगों के लिए, उसमें भी आप देखेंगे कि ये सारी प्रोसेस को अभी भी ऑनलाइन रखा गया है। तो आप तो बहुत सारे लोग जो इंटरनेट के किसी ना किसी तरीके से उसके ग्राहक हैं और इंटरनेट को इस्तेमाल करते हैं अपने तरीके से, मगर अभी भी एक बड़ी पॉपुलेशन है, जो कैमूर में ही एक बहुत बड़ा पॉपुलेशन है, एक पूरा ट्राइबल बेल्ट है जो कहीं भी ऑनलाइन
जो आपने अभी बोला है।
हाँ
जी,
हाँ, तो ये as he's saying that we have basically seen the ground realities of this place, and in many other places we are able to communicate with each other via these technologies, and we have seen how the entire issue of oxygen and other medicines, vaccination, etc., people have been able to communicate. He is talking about the fact that the vaccination for people who are under 18 has just been rolled out in Kaimur district.
मगर जो चीज है कि उसमें अभी आपको ऑनलाइन अप्लाई करना है। इस बीच कोविड का जो दूसरा संक्रमण है, दूसरा फेज का जो संक्रमण आया है, दूसरी लहर जिसको कहा जा रहा है, तो हम सभी लोग जो बिहार में हैं, जो देश के अलग अलग हिस्सों में हैं, वो इस चीज को महसूस कर रहे हैं कि हम किस तरीके से परेशान हुए, और एक नया सिम्टम कि बहुत सारे लोग जो रिकवर भी हो रहे हैं वो अब ब्लैक फंगस के शिकार हो रहे हैं, और इस बीच कैमूर में एक डेथ की खबर आ रही है जो कि ब्लैक फंगस से। तो ये सारी
मैं कर देता हूँ एक मिनट। there is also the issue that you have to register via the app. Meanwhile, there is also the news is coming about the fact that beyond COVID, there is also the black fungus, which is now affecting people who have already had COVID, and some of them have also recovered, but now they are being affected by the black fungus.
जी, तो इसमें जो चीज है कि अभी भी जब आप ग्राउंड लेवल पर जाकर के देखते हैं, ग्रामीण स्तर पर देखते हैं, तो कोविड के संक्रमण को लेकर के, कोविड को लेकर के कोई संजीदगी दिखाई नहीं पड़ती। भले ही लोग डरे हुए हैं और लॉकडाउन जिस तरीके से इम्पोज किया गया उसके बाद भले ही उस तरीके से निकल नहीं रहे हैं, मगर अभी भी गांव देहात में शादियां हो रही हैं, गांव देहात में जिन किसी की भी डेथ हो रही हैं, अगर कहें कि चूंकि कोविड के टेस्ट ही नहीं हो रहे उस तरीके से, तो लार्जर लेवल पर लोग जिनकी भी डेथ हो रही है उसके बाद श्राद्ध हो रहे हैं। और
so people are not taking this so seriously, even despite the fact that the new lockdown has been announced, and by and large you can see that people are going on about their daily businesses, marriage is going on, wedding is going on, social events are going on, and so on.
जी, तो इस क्रम में भी जो संक्रमण है वो फैल ही रहा है और कम्युनिटी के लेवल पर ट्रांसमिशन हो चुका है। जो कुछ भी सरकारी व्यवस्था थी, जो सरकार की तमाम व्यवस्थाएं हैं, आप अगर ग्रामीण स्तर पर देखेंगे तो वो नाकाफी है कि इस तरीके से संक्रमण जो भी है उसको वो टैकल कर सके, उसको हैंडल कर सके पहले ही। और यहाँ पर अगर आप देखेंगे तो एक तो पहले ही डॉक्टर्स की, नर्सेस की और तमाम तरह के सिस्टम जो कुछ भी है वो नाकाफी था। झोला छाप डॉक्टर जी।
Transmission is going on rapidly. It is spreading very rapidly. Already the government's response was not very good. Now we can see that in terms of doctors, availability of facilities and everything, the government's response is very insufficient.
बिल्कुल। हमारे आपके बहुत सारे लोगों का ये एक क्रिटिसिज्म हो सकता है कि झोला छाप डॉक्टर्स को लेकर के बहुत सारे लोग हे दृष्टि से उन्हें देखते हैं या उनको अपने अपने तरीके से क्रिटिसाइज करते हैं बहुत अलग अलग माध्यमों में। इवन कि जब पिछले विधानसभा चुनाव के दौरान भी ललन टॉप, जो कि एक पॉपुलर वेबसाइट है और उसमें एक मेडिकल प्रैक्टिशनर उनके संपादक को मिल गया था, तो उसका सोशल मीडिया पर बहुत मखौल उड़ा कि ये कौन होते हैं मेडिकल प्रैक्टिशनर्स। तो संभवतः वैसे ही जो मेडिकल प्रैक्टिशनर्स हैं जिनके पास एमबीबीएस की डिग्री तो नहीं होती है, मगर जिनको हम गांव देहात की भाषा में जो है झोला छाप डॉक्टर कहते हैं, और वो अपने तरीके से किसी को थोड़ा इंजेक्शन लगा सकते हैं या किसी को सर्दी जुकाम या जिस तरीके की भी इस बीच मास लेवल पर न सिर्फ कोविड है बल्कि मास लेवल पर हम ये देख रहे हैं कि साथ साथ टाइफाइड फैला हुआ है, मलेरिया का संक्रमण है। तो उस लेवल पर टाइफाइड का जो भी सिम्टम है कमोबेश वही कोविड का सिम्टम है। तो उसमें उस लेवल पर जो भी हैंडल करने का काम कर रहे हैं वो अभी भी मास लेवल पर ग्रामीण स्तर पर देखेंगे हम कि वो झोला छाप डॉक्टर ही जो हैं वो किन्हीं न किन्हीं तरीके से इस पूरे सिचुएशन को अपने तरीके से अपनी क्षमता अनुसार हैंडल कर रहे हैं।
So what he's saying is that the so-called Jhola Chhap doctor, these are the extension, the rural health extension people. They don't have medical degrees, but they are the ones who, on their bicycles and so forth, have the reach of getting inside the countryside and to the villages. They are the ones who have some training in giving primary care. They are able to give you injections if required. And he's saying that people treat them with a lot of contempt. They think of them as inadequate and jokes are made about them. And even the Lalan Top, which is one of those websites that many of us normally watch for news from Bihar and other places, they have also treated them without too much respect. And here is a situation where along with COVID, you have malaria, you have typhoid, you have a whole range of other illnesses which are rolling through rural Bihar, where the symptoms are very much similar to the symptoms that we know for COVID as well. And in that kind of a situation, the one sort of social actor who has the reach of the countryside is not your urban trained MBBS doctor, but it is the Jhola Chhap doctor.
ठीक है,
तो
जी
मैम। हाँ, तो यही है मैम, दरअसल जो ग्राउंड रियलिटी है वो कुछ कुछ इसी तरीके का है। हम पहले ही इस बात को जान रहे थे और न बिहार की सरकार या फिर हम केंद्र के स्तर पर भी देखें या अलग अलग राज्य की सरकारों की जो कहीं से भी रिपोर्ट्स आ रही हैं। मैं जब आपसे कैमूर में बात कर रहा हूँ तो कैमूर से सटा हुआ जिला है बक्सर, जहां पर पहल गंगा नदी में तमाम डेड बॉडीज देखी गई। आज भी मैं अपने जो साथी हैं करेस्पॉन्डेंट जो बलिया जिले में रहते हैं, बलिया और बक्सर और ये गाजीपुर, ये एक तरीके से बॉर्डर शेयर करता है उत्तर प्रदेश से, और गंगा नदी इस इलाकों से होते हुए ही जो है प्रवाहित होती। तो मगर जो चीजें देखने में आ रही हैं कि किस तरीके से जो बॉडीज हैं, कोई कह रहा है, उत्तर प्रदेश का शासन प्रशासन इस बात को कह रहा है कि वो हमारी डेड बॉडीज नहीं है, बिहार का शासन प्रशासन कह रहा है कि वो हमारी डेड बॉडीज नहीं है। तो आखिर इतनी डेड बॉडीज जो आ रही हैं और संक्रमण इस कदर फैल रहा है, और उसके बाद ये सारी चीजें, क्योंकि महीने 2 महीने के भीतर फिर इन नदियों में पानी आएगा और इन नदियों में बाढ़ भी आएगी, और ये बाढ़ आने के बाद जो मंजर होगा उसकी आप कल्पना करें तो मतलब सिहरने लगता है शरीर। तो यही सारी चीजें हैं जो ग्राउंड पर स्थितियां दिखाई पड़ रही हैं, और आगे आने वाली कोई तैयारी होती नहीं दिखाई पड़ रही शासन प्रशासन की ओर से, सरकारों के स्तर पर कोई संजीदगी नहीं दिखाई पड़ती। तो यही सारी चीजें हैं जो अभी हाल फिलहाल के लिए चीजें हमारे पास हम देख पा रहे हैं अपने आसपास।
So the last bit that he said was that, you know, in talking about ground realities, Kaimur is bordered by Buxar, which is in Bihar, and by Ghazipur, which is in UP. The river Ganga flows through it. In all of these places, you can see a lot of dead bodies everywhere. You can basically, he's also afraid that once the floods come in, which they will right after the monsoons, which will not be too many weeks from now, the scene that will be seen when all the bodies which have been buried on the banks of the Ganga will be prized by the waters, and they will be floating in much bigger numbers than before that we are aware of, and the governments are neither serious nor even fully aware of the situation. So he fears that what will be seen in the coming weeks will be far worse than what we have seen so far.
Thank you, ma'am.
Thank you. Thank you.
Thank you, Vishnu ji.
Good luck.
Thank you for letting me in. Thank you, sir. Thank you.
Thank you for your perspective.
अब बात अभी रहिएगा ना, क्यों ये सवाल जवाब भी होगा थोड़ी देर में, है ना?
जी बिल्कुल, अभी रहेंगे।
हाँ ठीक है,
इससे पहले मैं जी
ठीक है, आप रहिए। हाँ
ठीक है।
Okay, I think Abhay Mohan Jha is here with us. Abhay, if you can unmute yourself, please, and make yourself visible. Can we unmute him?
I've asked him, Abhay, I've asked you to unmute. You need to accept that, and then that will just take a second.
Okay. I'm not sure he's able to do that. I may have to reach him. Oh, I think he has. Abhay, are you here? Abhay? Abhay Mohan Jha, are you here?
He's here in the meeting, Rashmi, and he doesn't look like he's on mute, but we can't seem to hear him, obviously.
Okay, then maybe we can...
Should we continue with Nikita?
Yeah, let's continue and then come back to him.
Yeah.
Next up to speak is Nikita Sonavani. I believe she's here, who is a Dalit feminist, a lawyer, and a founding member of the Criminal Justice and Police Accountability Project in Bhopal. And Nikita?
Hi. I'm sorry, I'm going to have to keep my camera off because I'm in Bombay where the cyclone is raging. So the internet is a bit patchy. So it's just to save on my bandwidth. So thank you for that introduction and thank you for having me here. It's been really wonderful listening to all these varied insights on this subject matter. So as Rashmi mentioned, I'm a lawyer who I specifically work with communities known as the Vimukta Jatis, classified by the British as criminal tribes in Madhya Pradesh. And today I want to reflect on the question of COVID and law in India as a criminal lawyer, particularly through an anti-caste lens of criminalization. So I want to go back to March 2020, which is when the Indian government took cognizance of the pandemic, and the first response to the pandemic was to impose the lockdown, and this lockdown was imposed through a host of criminal laws. We saw the National Disaster Management Act being invoked, which mandated a closure of several establishments, and the act said that those who refuse to comply with the lockdown will face imprisonment up to 2 years along with fine. And along with this, the Epidemic Diseases Act of 1897, which is a colonial legislation that grants states unlimited and discretionary powers to prevent the outbreak or spread of an epidemic, was invoked. So we saw that state governments were authorized to charge those who were found to be violating regulations under Section 188. So prosecution under section 188 also followed the violation of section 144 of the Criminal Procedure Code, which is an offense punishable up to 6 months imprisonment and fine. And section 144, of course, has become infamously famous in India for being used to quell protests and dissent of all kind. So, of course, this invocation of a range of criminal laws meant that naturally there was heavy police deployment to enforce the lockdown, and overnight we saw what was an unprecedented public health crisis transformed into a law and order issue. So on the one hand, we have the Indian government and the state governments doing this. On the other hand, we have the Supreme Court of India, which is the highest constitutional court in the country, saying that prisons in the country need to be decongested. So Indian prisons again are known for being one of the most overcrowded prisons in the country and have an overcrowded percentage rate which usually ranges between 117% to 120%. So what we saw was this sort of dissonance between the Supreme Court's orders and the government's actions, which was made particularly obvious through the system of policing. So my colleagues and I at the Criminal Justice and Police Accountability Project wanted to see how this policing was being carried out during the pandemic. So we conducted a study of policing during the pandemic and in Madhya Pradesh, and discovered that those who were arrested during the period of the lockdown, were arrested for allegedly committing minor bailable offenses such as gambling, hurt, and alcohol possession. So furthermore, policing during this period basically then comprised of these offenses. Now, in popular imagination, people think that the police are used to prevent serious crimes like murder and sexual violence, when in reality, we saw that the primary focus of policing was law and order maintenance through cracking down on people for committing seemingly victimless low offense of harm offenses. Now, it was also important for us to see who are these people that were being arrested for violating the lockdown, right? And unsurprisingly, we saw that 30% of those belong to Dalit, Adivasi, and Vimukta communities, about 20% belonging to other backward classes, and nearly 25% of them belong to Muslim communities, which essentially translates to approximately 3 of every 4 individuals arrested during this period belong to a marginalized community. And more specifically, these FIRs were registered against street vendors, low-income shopkeepers. So every 5th individual who was policed during this period was either an essential service provider, like someone who sells groceries, vegetables, fruits. And we saw some really seemingly frivolous FIRs being filed against people, particularly people from the Muslim community, for expressing their, support for a particular faith. We saw that, this whole crisis was given a communal angle by saying that the Tablighi Jamaat was responsible for the spread of COVID. And we saw the police filing FIRs against people putting up WhatsApp statuses saying, I support, the Nizamuddin of Karkaz or the Tablighi Jamaat. And along with this, of course, in the public domain, we saw videos of multiple instances of police brutality and custodial murders, like the one in Tamil Nadu of Jairaj and Benix, right? And along with this, now the judiciary, which at least in theory is supposed to act as a system of checks and balances, was functioning at a suboptimal level given the pandemic. So for us as lawyers, access to bail applications were still being heard during this period, were impeded during this period. So for instance, one of the cases, which was the case of a young Pardhi man, Pardhi is a Vimukta Jati, was arrested right at the beginning of the pandemic in April for being in possession of about 60 liters of country liquor. And this young person suffered from tuberculosis, and he was incarcerated for nearly 3 months for an offense that is punishable by a mere 3 years. And we saw that it was difficult for people, particularly from marginalized communities, to get bail during this period, given the pandemic and given the low functioning of courts. So what we're seeing during this period, of course, this sort of indiscriminate policing and the way that the police was arresting and incarcerating people, we saw that this ultimately convulsed into the prison population in several states being higher than what it was when the pandemic began. And the National Crime Records Bureau, which is, a government-run agency that keeps a track of crimes and prison population in India, it saw that there was an over-representation of Dalit, Adivasi and Bahujan communities in the prison population, which has of course historically been the case when it comes to the criminal justice system in India. So what we essentially saw during this period, and something that I want to highlight as we proceed forward, is we saw this form of legally sanctioned violence, which has been historically perpetuated through the criminal justice system, being exacerbated during this period. So at this point, we're in a situation where, you know, we have parole and bail being granted to prisoners, but prisoners, you know, refusing to access that opportunity because the situation in the country and the public health system is in absolute shambles. So what we're seeing now is this sort of binary that has emerged between life and liberty. And this has happened because so much of the focus of state funding and police and resources during this period has been in the criminal justice system, particularly the structures of policing in prisons, as opposed to the healthcare system which it should have been. So like I was saying earlier, we've seen that, you know, the Indian state largely rules through through the system of policing, through the machinery of policing, and this sort of facade of saying that, you know, we're responding to this healthcare crisis and that we have this crisis under control was generated by perpetuating this narrative of being a law and order problem through criminal law. Thank you.
Thank you so much, Nikita. That was really powerful and I think important for us to hear. And so thank you for your contribution. I can now see Abhay Mohan Jha, and hopefully we can hear from him as well. As I'd already introduced him earlier, Abhay is a freelance journalist and a farmer who's based in Bettiah in Bihar, and he has been filing stories from there on the ground. So Abhay, can we have you speak for 5 minutes?
Good evening, Rashmi, and thank you for having me. Hello, can you hear me?
Yes, we can hear you.
Yes, I'm sorry I wasn't in, couldn't join earlier. I missed on what all the other speakers have said. But my take on the pandemic is I see it as a huge Canadian disaster. By this pandemic since
Abhay,
last year, the
Abhay, I'm so
migrants
sorry.
coming down.
I'm so sorry to interrupt you, but your bandwidth is very low. I wonder if you can perhaps switch off your video and just go to audio, because we might be able to hear you. Just go to audio.
Okay. Am I audible now?
We can.
हाँ, एकदम ठीक है. अब ये वीडियो ऑफ कर दो ना, खाली ये ऑडियो से आ जाएगा.
हेलो, अब ठीक है?
हाँ, बिल्कुल ठीक, फर्स्ट क्लास.
So last year, the migrations, the reverse migrations, that was a major crisis, but we did not wake up. And the deaths, which has touched each and every one of us, I'm sure, either known people, family, acquaintances, this puts a huge question mark on a health infrastructure, on a governance, if I can say that. Here in Bihar, I would give, please allow me to slip into anecdotes, and probably I'm a journalist and I tell stories, and stories, they bring out the larger picture. Can I have the video, please? Yes. In 2011, a book came out, Bihar Breakthrough, story of the turnaround of a beleaguered state, that is my state of Bihar. the author who traveled across Bihar. He had come down to Bettiah, I took him around, and he documented it. Dr. Rajesh Chakravarti was from the Indian School of Business. He sifted through the entire paradigm of Bihar, which used to be called a basket case, and how we came around. There was so much of hope. But Dr. Chakravarti wrote his book in 2011. Nitish Kumar had already run 5 years of his regime, which was a dream run. It was a honeymoon for the people of Bihar. And we had really taken off in every sector, education, health, and where there were no hospitals working, things came around. The public-private partnership that the Nitish Kumar government entered into, that was seen as a major breakthrough. But when Dr. Chakrabarti shared his manuscript with me, sometime late in 2011, I got back to him with, minor mistakes or minor corrections for an outsider to write on Bihar. But I called him up and I said, Dr. Chakrabarti, your book is coming a year bit too late. The downslide has begun. He did make an oblique reference on the media itself. The media, which was having a honeymoon, they continued writing goody things about the government. Press releases occupied much of our space. It has continued till date. Journalists stopped going into the interiors. They did not travel. They did not see the speed breakers which were coming up. They did not see a new comptroller class of middlemen who were sabotaging development. And 2011, this happened. But 3 years before that, Chief Minister Nitish Kumar came and laid the foundation stone of a medical college in my town of Bettiah. This was in 2008. Now, Bettiah has had a lovely district hospital. The benefactor was the erstwhile Bettiah Raj. It was named after the last Maharani Janki Kaur. And once the medical college came up, a sort of deity came into existence, like after Plassey in Bengal. The college principal, he became the head of a large team of doctors who were mostly truant. We were told that each faculty member is actually enrolled in different medical college, more than one, and that is why they are not here all the time. This is 2011, the book came 2008, the foundation stone was laid. Slowly the work began. 2 years after this book came, I will tell you a personal experience. Sometime in mid-2013, I had to carry my mother to the hospital. She had lost consciousness, she stopped breathing. Fortunately, I had a canister of oxygen. Oxygen, that is the buzzword now, that is the most wanted thing. I revived her, I took her there. There was no stretcher, no trolley. I ran with her in my arms. The doctor sitting, fortunately, there was a doctor, but we had medicines, we had carried a nebulizer. The doctor was taken aback. He had been posted to the medical college and he was not familiar with the place. He was shocked that these medicines are available here. I just told him, doctor, you don't have to diagnose. My friend, my childhood friend, he is a physician, he's a family physician in Patna. He had been treating my mother. So we found her a bed in the female ward. There was an iron cot lying on the veranda. It was reeking of urine stench, but we put her on there. She was put on oxygen. Mosquitoes were buzzing. And while I was running around with my mother, I saw people with jholas, bags, carrying nebulizers, medicines. They tried to pounce upon me. They tried to trap me. I lost my head. I shouted. Then somebody who knew me, he shooed them off. He said, you don't know who he is. He's a journalist. Tomorrow he'll be behind bars. I brought my mother back. I had with friends in the government, in the medical profession. I was able to bring back my mother, and she lived for another year.
Abe, I'm so sorry to interrupt you, but I wonder if you can wrap up because we have three more speakers after this.
So that was the scene, and now the medical college has come up. The old hospital has been demolished. It is a hospital which is supposed to be 850 bedded. The oxygen plant that they have set up is coughing. For the last 1 month, we are hearing that it is coming into action. It is being operationalized, but it is still not delivering enough oxygen. The capacity, I am told, is 20 to 40 cylinders a day for an 850 bedded hospital. How could the DPR contain an oxygen plant producing just 20 to 40 cylinders a day? The ICU, the COVID ward ICU, is 200 plus full. And each critical patient is consuming 4 cylinders of oxygen. So that is the ventilators again. Ventilators were lying packed from the PM CARES fund. And that is the story across Bihar. And when this pandemic has hit, the scene is terrible in the villages where quacks are treating people and deaths are not being counted as COVID deaths because they say these people have died of typhoid, heart attack, some say even pneumonia. And the worst thing is that the lockdown is partially effective even now. And when there are deaths happening, people are congregating for funerals, for funeral feasts. Even a COVID patient's, COVID deceased's body, the family members ripped off the body bag and they had the last darshan. And people are dying. So the messaging is wrong. The government has been taken aback, and all the goody stories we were hearing, we stand totally exposed.
Thank you so much, Abe.
Thank you so much, Abe, for giving us the context within which this current catastrophe is unfolding. So thank you for that. I think we can move to our next speaker. We can't.
I think the next we can move to Bilal. Bilal Zaidi. Bilal is a Delhi-based journalist and a CEO as well as co-founder of Our Democracy. Our Democracy is an online platform for managing election campaigns. In the present times, when we are witnessing a major right-wing politics around electoral bonds and corporate funding, Our Democracy underlines the importance of transparent crowdfunding for elections. They have campaigned for several candidates, including Jignesh Mewani, Kanhaiya Kumar, and Nana Patole. As a matter of principle, Our Democracy do not support candidates having background of gender violence and hate speech. Bilal.
Thank you so much, Shrikantji, and thank you so much, everyone, for inviting me here. Extremely knowledgeable audience, as well as all the speakers have really brought in some amazing points here. I'll just try to keep my focus broadly around the response of the civil society. So as an organization, Our Democracy focuses mostly on political interventions. So they could be electoral as well as non-electoral in nature. We also support lawyers. We also support journalists. Essentially, the idea is we try to raise funds for anybody working towards the cause of democracy or wanting to strengthen democracy. We've also been making interventions in terms of COVID relief because we believe leadership emerges through crisis. A lot of the people on the ground today that are working are actually trying to address the massive gap that has somehow been created because of uninvolved political brass. There's been a lot of criticism of central government. In fact, those who are working on the ground, even in opposition-ruled states, they can tell you that things are not drastically better there. Either we are actually seeing a massive collapse of the entire health infrastructure, especially in rural areas. And to be able to respond to this crisis with whatever we can, although as citizens, as civil society, there's only that much we can do. What we are seeing on the ground in India is a lot of heartening interventions from average ordinary citizens all over India. Neighbors helping each other, organizations coming together, non-profit organizations, in fact, working through hundreds of WhatsApp groups, coordinating resources, trying to figure out what is to be found where. So what we've seen over the last couple of years is essentially a strengthening of this fabric around our civil society. And when I say civil society, it's not just the registered, organized organizations and groups. It's actually a lot of people just responding to messages online and joining these efforts. A lot of the people who are now becoming part of these efforts were, you could say, were also apolitical as people in the past, and now increasingly they are finding their voice in terms of political expression as well, because they are now on the ground. They are dealing with the state. They are trying to figure out how to procure medicines, how to procure rest of the material, oxygen cylinders, ventilators, concentrators, and so on. I also want to throw in some light on the challenges that are being faced by the civil society. And now that we have a larger group of people connected to individual action. Earlier in India, a lot of you who kind of have been working in the civil society space would understand that there was a very limited, defined number of people who worked in the civil society space. That space is expanding drastically, which is the good news. And since that space is expanding, there's also a realization that you could use this moment to politicize all these new people joining in, help them understand what their rights are, how our democracy is designed, what is the responsibility of various agencies, from central government to state governments to local municipalities, to working with bureaucracy. How do you deal with the police in certain areas? How do you deal with the local administration in certain areas? So all of these learnings have come in, and what we are now in a way noticing is that a lot of people who are expressing themselves very openly online may not have been political by nature in the past. So I think that's the silver lining that's coming in. In terms of challenges, they continue to be there. I think our supply chains have totally collapsed. You can also blame some of the governance policies as well in terms of procurement. Some of the procurement laws that exist do not allow individual intervention. You need to go through certain policy systems. Those systems in themselves are very problematic. I'll give you the example of something as simple as the FCRA law, which kind of makes it difficult for NRIs, and forget about like NRIs who are working elsewhere, just people who are right now outside of India wanting to support their own family members in India. They can't do it through organized systems, through organizations. These laws have been very, have been made more difficult since the pandemic began last year. One would assume that you would want to streamline the various policy infrastructure. You would want to streamline the supply chains, make sure that the larger NGOs have a network with smaller NGOs, so that all of these combinations are explored and there's a better supply of whatever is available. But that hasn't happened. New laws kind of prohibit larger NGOs to coordinate with smaller NGOs or give away any part of their grants as sub grants to other organizations. These are challenges that are making things extremely difficult. But once again, I would want to stick to what we're seeing on the ground. We're seeing that the efforts are coming in from individuals. A lot of people are not even considering our political establishment as people who could respond to the challenge. There are some positive stories. You see some very good initiative coming in from opposition political party members who are now available on Twitter, who are available online and everywhere. So I feel this moment is kind of bringing in a new set of knowledge.
Bilal, I'm so sorry to interrupt, but if you could wrap it up, please.
Yeah. So I feel this is, while the challenge has been there, I also feel this moment has given us an opportunity to all of us as a group, as a larger society, to come together. And I hope this momentum could be taken forward as the civil society organizes themselves better. Thank you.
Thanks, Bilal, for explaining the challenges that you face while thinking about COVID relief and the way in which our democracy is trying to get into the relief measures. Thank you. The next speaker is Rajendra Kaur. Ravinder is Associate Professor of Modern South Asian Studies at the University of Copenhagen. She has worked on a range of issues from partition and modern Indian citizenship to religion, violence, and political mobilization in South Asia. Her recently published work, Brand New Nation, speaks about how capitalist transformations have redefined the ideas of nation, territory, population, and culture, and have packaged them into making India into an attractive investment destination. Ravinder, please go ahead and make your presentation.
Thank you very much. Yeah. Can you hear me?
Yes.
Okay, thank you very much for inviting me here, and it has been very informative to learn so much from the previous speakers. I think I want to take up one issue, which is, which we call the failure of governance, which has come up quite a lot in the recent days. And recently, Outlook magazine had printed the cover, which basically said missing. And the government is missing. An economist also made a cover story which talked about the Indian government, which seems to have melted away. But I think what we need to do is to, what I want to draw attention to is that actually the government is not missing. The government is very much present, and it is working full time, and it is working exactly in the ways in which it has always worked. So it may sound a little bit counterintuitive, but this is what I want to talk about, the active and passive presence, absence of the Indian government at this moment, which is creating this crisis. So if we look around, I think one of the first things we come across is that, the Central Vista project in Delhi is going on full speed. That has not stopped at all. In fact, most of the governmental hurdles or problems that we have been talking about in terms of vaccines or ICU arrangements or availability of, or the lack of availability of oxygen, etc., those kind of things have not appeared in this case. So the Central Vista project is going on full speed. So the state is very much present in matters, in areas where it wants to be present, namely things which are a priority. So that's point number one. So if that is the case, then what kind of failure are we really speaking about? Here I would say that we need to focus on the form of governance that the BJP government has evolved, not just during Corona period, but throughout the past 7 years. And I would suggest that governance has become a form of spectacle, or rather spectacle itself has replaced traditional governance. And what I mean by that is, and by spectacle, I'm referring to this idea that everything needs to be attention grabbing. And of course, I'm also referring to this larger, wider point about, autocratic rule of the market economy, which the BJP government has been pursuing. So the spectacle as a form of governance is nothing new, but during the Corona period, it has become a predominant form of politics, mass-mediated politics. Right from the beginning in March, we could see that every other announcement which was made or every policy which was initiated, that was accompanied by mass-mediated spectacular announcements. I don't need to go through the list. Everyone knows the different, from the Janata curfew or the public rituals which were performed on the streets and so on and so forth. So that kind of, that somehow took precedence over everything else. I must also mention that as a scholar who has been studying both economy and mass mediation of politics in India, I have been very amazed that, COVID has actually, the pandemic has opened up a comparative frame where we can see how different governments function across the world. And where I am right now in Denmark, I mean, it could not be any more different than what happens, in Modi's India. So what we see here is that there is a lot of, big, colorful celebration where the Prime Minister always is at the center of events. So that's one thing I wanted to point out too, that governance hasn't failed. What we are witnessing is spectacle as governance, which is the signature of the present government. The second thing I want to draw attention to is that India seems to be under the curse of good news or good times. Now, as everyone knows that, Modi government came to power on the promise of good times, and the running theme which has, which underlines or highlights this government is how the chasing of good news, the focus is on how to continuously produce and circulate good news, which somehow has become a substitute for the lack of good times. And by good times, I mean the promise of economic growth or, bringing the civilizational glory, etc., which we are all familiar with. Everyone knows that economy, even before the pandemic, was on downhill. Unemployment had risen to record highs. And of course, the pandemic comes and the situation, as everyone knows, that India actually has lost nearly a quarter of its GDP last summer, the highest in the world. So what do you do about it? So the production and circulation, the constant consumption of good news is something which has almost become a reflexive nature. This could be witnessed recently by, I think just last week, RSS organized a workshop meeting called Positivity Unlimited, where the theme was that the mood is too grim, that people are speaking too negatively, that we need to introduce positively. And I think every government supporter on social media or elsewhere was talking about the need to remain positive. Now, the interesting thing about this is positivity in itself is nothing new. Even in the previous regime, before the BJP government, I mean, this was something already pretty visible. But under this government, good news or this need to speak about positive, to remain positive, has replaced or overtaken everything else. And why this is problematic? It is because no one really wants to hear what is bad or what is grim, or the critics are basically told to shut down because they are bringing bad news. Nobody wants to look at the pictures of dead bodies. And just a few days ago, there was this entire, backlash or going on that the images of dead bodies, they hurt Hindu cultural sensitivities, which was surprising that, many people were not bothered by the dead bodies or the fact that people had died and these were unnecessary deaths, but the fact that these images were being produced, which cut the government's message to remain positive, right? So what I'm trying to think along is that what should have been, the harbinger of good times actually has become a curse. That if only India had space for its critics, people who would feel comfortable telling the truth, bringing the bad news, things would not go so wrong. And this, of course, is connected to the larger question of democratic erosion, that dissent is barely tolerated. And, any kind of policy making can only thrive if there was an atmosphere where people could tell the truth. So these days, everyone is talking about that the policy part, of the government, policy making is actually, constituted of sycophants, people who are yes men, who just want to tell the good news.
Ravinder, so sorry to interrupt you, but I wonder if you can please wrap it up, so we have one more.
Yes, so actually I was going to the last point, which is, where does this lead us? I think it seems to me that the BJP government has learned the lesson, which once upon a time Andre Agassi, the star, the tennis star, had spoken about, which is that image is everything, that there is nothing but the image. And I think what I've been struck with is the production of images and production of, dead bodies. I think what I want to leave you with is this image, which was circulated 3 days ago. It is this image of, corpses which have washed ashore on the banks of the river Ganga. And when you look at that image, first you think these are pebbles lined up along the shore, but then look closely and then your heart stops, because these are dead bodies half buried in the sand. And I think this is where the question of image and death becomes so obvious to us, that the dead bodies which were discarded for multiple reasons in the river, they continue to come back. They are not leaving those people alone, that they want to be seen, and they mark their presence, if not in life, then in their death. And I think that kind of, failure, I mean, the notion that image can be controlled, or that, publicity in itself can somehow overpower everything else, I think this is where we see the falling apart, breaking down of the spectacle. I'll just stop here. Thank you.
Thanks, Ravinder, for your presentation and for for discussing how spectacle as a form of governance has become the reality in the COVID times, and how terminologies of good times and positivities have become a curse to the Indian democracy.
Okay, so our final speaker, or rather performer, is Reika Surya, who I think is having some internet issues, which is a real pity, because she had prepared something especially for our meeting, and what is a public meeting without it ending in song.
Hello, namaskar, adab. I want to thank SOAS and Warwick for inviting me and giving me this opportunity to air my views about the mishandling of the pandemic through poetry. तो शुरुआत मैं कर रही हूँ शहाब जाफरी साहब के बंद से, a verse of Shahab Jafri, who was a 20th century poet. तू इधर उधर की ना बात कर, don't speak about this and that. ये बता कि काफिला क्यों लुटा. Tell us, why was the caravan looted? Really referring to PM cares and the money that citizens gave. मुझे रहज़नों से गिला नहीं. My complaint is not against robbers, thieves, marauders. तेरी रहबरी का सवाल है. It's your leadership that I question. And then I tumble on to this nazm of Faiz Saab, a revolutionary nazm. बोल के लब आज़ाद हैं तेरे, speak because your lips are free to speak. बोल ज़ुबान अब तक तेरी है, speak because your tongue is still your own. तेरा सुतवा जिस्म है तेरा, your erect body is yours. बोल के जान अब तक तेरी है, speak because your life is still your own. देख के आहनगर की दुकान में, after seeing the ironmonger's shop, तुंद है शोले सुर्ख है आहन. the sparks of the ironmonger's sparks are flying red hot. खुलने लगे कुफलों के दहाने, because of which all the locks are being opened. फैला हर एक जंजीर का दामन, that each link of the chain is being opened. बोल ये थोड़ा वक्त बहुत है. Speak because we have little time. जिस्म और जान की मौत से पहले, before my life and my tongue die, बोल के सच जिंदा है अब तक. Speak because truth is still alive. बोल जो कुछ कहना है कह ले. Speak and whatever you want to say, speak it out. तू इधर उधर की ना बात कर, तू इधर उधर की ना बात कर, ये बता के काफिला क्यों लुटा, मुझे रहज़नों से गिला नहीं, मुझे रहज़नों से गिला नहीं, तेरी रहबरी का सवाल है, तेरी रहबरी का सवाल है. बोल के लब आजाद है तेरे, बोल के लब आजाद है तेरे, बोल जुबां अब तक तेरी है, तेरा सुतवा जिस्म है तेरा, बोल के लब आजाद है तेरे, बोल सुबह अब तक तेरी है, तेरा सुतवा जिस्म है तेरा, बोल के जा अब तक तेरी है, देख के आहनगर की दुकान में तुंद है शोले, सुर्ख है आहन, खुलने लगे खुलने लगे खुलने लगे कुफलों के दहाने,
Jayanti, should we make a couple of announcements and thank the speakers who we hope will stay on, because there are lots of questions in the chat. We also would like to invite people to speak. If you want to, raise your hands and we will try and keep track of that. You can actually address the meeting, or you can write your questions in the chat channel.
Can I just make an announcement here, which is that I've extended the meeting for another hour. So instead of getting over at 4 p.m. British summer time, it is going to be at 5. So please feel free to stay behind and take part in the discussion. I see Reika has re-entered the room, so let's see if she can.
Yes.
We can have her now.
Yes.
Hello,
Reika?
Reika, can you hear us?
We can see her, but there's no microphone.
She's off mute, or she's not on mute. So Reika, you might have received a request to unmute yourself. You just need to accept that.
Okay. I could try calling her on Messenger to see.
I think we could try that. In the meanwhile, thank you so much to the audience for all of your comments and questions. There are a lot of really interesting comments in the chat, which we don't have time to read out, but I hope that everybody has the chance to read them. And obviously this recording will be posted to the WICID YouTube, so you'll have the chance to look at that. For those of you who have posted your questions, we've gathered them up, and what I think we could do is to start with some of those questions, and then when we have Reika and we're able to connect her up, we will go to her. So Rohini, I wonder if you want to ask the questions to the speakers?
Yes, of course. We have a lot of questions, some really interesting ones. So I will direct them at the speakers and perhaps they can take them one by one. So we have the first one for Murad. Murad, are you around? Is he there?
Yes, I'm here and I'm now unmuted.
Wonderful. So the first question is for you, and this one says, will we ever be able to figure out the exact scale of the devastation in India in terms of numerical figures, given the limitations that you've put forth?
I think that it'll be very difficult to figure out the exact scale, but I think that as time goes on, we'll get a better and better idea of what the scale has been, because there are different sources of data which will continue to come in. We'll have eventually some SRS data from the census. So this is sample registration survey data, which will be able to tell us about mortality. It won't be perfect. It'll give us estimates, not exact numbers. We'll have hopefully other bits and pieces of data. There are a number of different surveys which are carried out routinely, and and there might be surveys which are not carried out routinely, which are done eventually to actually map the kind of toll of the pandemic. So my hope is that some of that will be done, but in the short term, we're looking at really just trying to estimate in a very broad way the toll and see just how much huger it is than what we're actually seeing in terms of numbers of cases and deaths.
Thank you, Murad. We have some really great questions for Rajendra Bharud, but it seems as if we've lost him for the time being. So I will move on to a question for Nikita. Nikita, we have a question that speaks of the arresting of activists, political prisoners under the various legislations, and if there are any ways that we could question or challenge them. So many of them have been languishing in prison on flimsy charges, non-bailable, and so on and so forth. So your thoughts on that?
Hi.
Sorry.
I was just waiting to be unmuted. Yeah, sorry. Rohini, can you please repeat the first part of the question?
Yes, Nikita. The question asks you to reflect on the various arrests that have been made of activists, students, political prisoners for speaking up against the government under the UAP and so on and so forth. And how do you see, your thoughts and reflections on that?
Okay. I think before I answer that question more specifically, I just want to clarify that, there is a common usage of the category of political prisoners, and at least in the Indian context, that's a misnomer, for the reason that the criminal justice system and the policing system is rooted in the caste system. So people who are arrested and are made prisoners by the criminal justice system are those who belong to various marginalized communities. Therefore, all prisoners are political prisoners. And to answer more specifically the question about the UAPA, etc., I would like to say that the legislation like the UAPA is ultimately a culmination of the wide-ranging discretionary power that the executive has, particularly with regards to criminal law, right? Of course, the UAPA is a construct of the UPA government, and it in all ways subverts whatever sort of safeguards of criminal procedure puts together. So the only way to be able to respond to or deal with a law like that is to really push for its repeal, because it's unconstitutional on all counts and really has no place in any sort of constitutional democracy. So I think that one is, of course, focusing on that, but largely also thinking about questions of decriminalization, right? Because what this government has been able to do is to be able to really tap into that sort of penal and retributive sentiment that the society harbors, right? Which is to say, well, we're in the middle of a public health crisis, let's rely on criminal law. If it's sexual violence, let's rely on criminal law. So I think it's made criminal law that sort of one-stop response, which has, of course, with this government has they managed to tap into that, and really that has culminated into the sort of indiscriminate usage of a law like the UAPA. So I think these are both aspects for us to reflect on while thinking through this question. Thank you.
Thank you so much, Nikita, particularly for clarifying what we understand to be political prisoners and how to reflect on that. We are opening the floor for questions now from all our participants, speakers, anybody. But before that, we have one question for Vishnu from Subir.
And we also have a hand up from Vidya, who will come to straight after Subir's question.
Yes. So Vishnu, if you can see the question and if you can hear us, could you speak a little about your experience with Jhola Chhap doctors and the role they are playing in this current pandemic?
हाँ बोलिए, हम आपका करेंगे अनुवाद।
हाँ, दरअसल मैंने झोला छाप डॉक्टरों से मतलब इस सब की सामान्य जिज्ञासा होती है कि ये झोला छाप डॉक्टर हैं कौन दरअसल, और ये किस तरीके से ट्रीटमेंट कर रहे हैं। तो आप जब गांव देहात के इलाकों में घूमते हैं तो पाते हैं कि उनके पास बहुत छोटी सी गुमटी नुमा दुकान है। बहुत छोटी दुकान क्या है, कहें कि उसमें वो थोड़ी बहुत दवाइयां लेकर के बैठते हैं और अपने साथ इंजेक्शन और सिरिंजेस होते हैं उनके साथ। और इस बीच जिस तरीके का भी संक्रमण आ रहा है, क्योंकि आप जाकर के उनसे ये सवाल पूछते हैं कि क्या आप लोग कोविड का भी ट्रीटमेंट कर रहे हैं, तो बोला नहीं, हमारे पास जो कोई सीरियस केस, इस तरीके की कोई दिक्कत परेशानी वाले लोग आते हैं तो हम उनको आगे बढ़ा देते हैं। मगर बहुत सारे लोग जो कोविड के सिम्टम्स जिस तरीके के हैं, वैसे सिम्टम्स जो हैं मास लेवल पर टाइफाइड के भी हैं। तो टाइफाइड के लेवल पर वो किस तरीके से ट्रीट कर रहे हैं लोगों को, वो पैरासीटामोल और तमाम तरह की दवाएं, किसी को इंजेक्शन की, या कई बार जो देहाती भाषा में बातचीत होती है कि पानी चढ़ाने की बात हो जाती है, किसी को जरूरत होती है तो। और उनसे पूछने पर कि आप लोग आपके पास क्या कुछ कह रहे हैं, किस तरीके के, तो सर्दी जुकाम खांसी, और उसके लिए एक लोकल टर्म इस्तेमाल हो रहा है जो कम से कम भोजपुरी पट्टी में तो इस्तेमाल होता ही है, कि घर जनवा। घर जनवा का कहने का मतलब है कि महामारी जो घर घर तक फैल चुकी है, और ये ऐसी महामारी, ऐसी हवा है जो घर घर तक पहुंच चुकी है और लोग डर रहे हैं। जो कोविड का संक्रमण है और कोविड के इलाज को लेकर के भी जिस तरह की व्यवस्था है, अगर कोविड किसी तरीके से डिटेक्ट हुआ तो उसके बाद ये होगा कि उसको कहीं ले जा करके कहीं कैद कर देंगे क्या? अगर किसी का कोविड डिटेक्ट होता है तो उनको जिस तरीके का इलाज मिलेगा वो बिल्कुल अपने परिजनों से क्या बिल्कुल दूर हो जाएंगे क्या? जब हम बिहार के अलग अलग हिस्सों में घूम रहे हैं या फिर मैं अपने जिले में भी घूम रहा हूँ, तो देख रहा हूँ कि जो यहाँ का कोविड केयर सेंटर भी है, वहां पर मरीज और परिजन एक साथ हैं। आमतौर पे अलग अलग जगहों पर या फिर देश के ही अलग अलग महानगरों में जब हम देख रहे हैं, तो जो कोविड केयर सेंटर्स हैं उनमें कोई मरीज के परिजन नहीं उनके साथ में जा सकते हैं। मगर यहाँ का जो भी आप कोविड वार्ड देखेंगे तो देखेंगे कि मरीज और परिजन एक ही साथ हैं। और तो इस तरीके की दिक्कतें जो हैं वो उसको हैंडल कर रहे हैं। तो झोला छाप डॉक्टरों से जो बातचीत करके जो चीजें हमने पाई वो ये है कि झोला छाप जो डॉक्टर हैं वो इसी तरीके से ट्रीटमेंट कर रहे हैं, जो कुछ उनकी समझदारी है उसके स्तर पर वो डील कर रहे हैं।
ठीक है. So just to translate, he has spoken with the Jhora Chhap doctors, and there is a general curiosity regarding who these people are, how are they doing, how are they dealing with these different kinds of symptoms that people are having, given that their own kind of role and training is not of an advanced medical sort. But what is an important thing is that through them he has been able to find out that the disease has gone from home to home. What is the local term from the Bhojpuri belt is ghar janua, like a disease that has traveled from home to home. Secondly, that patients are very scared that if they are tested positive, will they be removed from their families? Third, that in the local healthcare facilities such as they are, unlike in the bigger cities or in the bigger hospitals where the patients are separated from their family, here we can see that the patients and their carers and their families are actually together. Even when the patient is in the hospital, as much as possible, the families want to be there. And one thing one can take from this, and that is not something he said, is again a messaging issue, which is that people feel that, what if they die and they never see their families again? And that kind of a fear of never seeing your family, to be left to die in a hospital without too many facilities, that is driving some of the behavior which intuitively is having an effect on this. Thank you, Vishnuji.
Thank you, sir.
Dia, do you want to ask your question?
Yes. Actually, my internet is a bit slow, so I'm not using the video. I was actually interested in contributing some comments to the discussion. So my PhD research at SOAS is on the right to information movement in India. And during the COVID lockdown, I collected a lot of information on how RTI, the right to information law, is being used to sort of monitor the government's response to the pandemic. And that threw up some very interesting information which I thought I could share in this forum. So one of the things that came out is that in January, there was a news story about Donald Trump's trade advisor warning him that COVID is going to become a big pandemic and that government should step in and take action. But at that time, the government chose not to act on, the Indian government chose not to act on that, even though the government was hosting Donald Trump, around the time when the pandemic had already started rearing its ugly head. So there were a series of right to information queries which one of the journalists, Saurav Das, had filed with the Health Ministry and ICMR, and which showed that the government actually dragged its feet with regards to responding to the pandemic in time. So, and one of the responses that this journalist got to one of his RTI queries showed that the government even though there was a separate fundraising effort on the part of the Prime Minister's office under the PM CARES Fund, they borrowed heavily from international finance institutions to fund some of the COVID relief measures. So which raised an important question about, why is the government borrowing heavily, taking debt to meet its COVID, interventions, relief interventions, when it's already collected crores and crores of funds under the PM CARES Fund. And as I think many of you might already be aware, that the government had stonewalled a lot of right to information queries on what it was doing with the PM CARES Fund for COVID relief, and information was not shared. But one of the good things that also came out of the public pressure mounted on the PMO's office to, show what it had done with the COVID relief money was that it actually had to reveal the founding document of the PM CARES Fund itself, which was not.
Yeah, I'm so sorry to interrupt you. We do have a couple more hands up and some concluding remarks. So I wonder if you can wrap up your really interesting comments. Thank you.
Yeah, so basically, well, to wrap up, I would say that there have been very interesting right to information like interventions which have helped reveal how the government did not act fast enough to address the pandemic. But at the same time, there's also a huge void in terms of information, and right to information has not really helped get all the information that should have been there about the pandemic. So yeah, I would like to conclude with that.
Thank you, Vidya. We have another question, Rohini. I think that this will probably be our last question, and then we will go to Subir for concluding comments.
Yes, we have a question from Avnish Kumar, I think.
Yeah, just one, I wanted to share sort of my discomfort and also possibly a fear about this discussion about the Jhola Chap doctors. I have spent last 1 year in my hometown in Northwest Bihar, and I understand and appreciate that the Jhola Chap doctors have played a very, very important role. They have been playing this important role in the past too. But I just want to highlight that these, this kind of, I'm not saying that this is what is happening here, but perhaps what is the public policy lesson that we are drawing from the fact that there are so many Jhola Chap doctors who are at the front line of this COVID-19. It should not be. Remember that India already is the antibiotic resistance capital in the world, and within India, Bihar is the worst case. Antibiotics are given left, right, and center. I'm not a medical doctor, but last 1 year I had a lot of time to spend with close friends who have been practicing in these areas, MBBS doctors, and they have been. So these are stories that I have also heard, and. Because what happens really is that sometimes public policy draws the entirely wrong lesson from these kind of stories, and very, very well-meaning stories and facts about rural life. And they instead would like to then, in a way, institutionalize, Jhola Chap doctors into the entire structure of public health system, which I think will eventually lead very bad outcomes in terms of public health in already compromised COVID-19 situation and in a place like Bihar. One last comment about typhoid. COVID-19, as you know, as everyone knows by now, does not require any special intervention for a large majority of people, but over-medication has become a big issue in many of these areas. And typhoid is a misdiagnosis of COVID. Many a times when you have COVID, Vidal test, which is used to diagnose typhoid, comes out false positive, and it has become almost in these areas. Everyone who has COVID will tell you that हमको COVID नहीं है, हमको तो typhoid हो गया है. it's not COVID, it's typhoid. And, you know, people are getting medication for typhoid. So just wanted to raise this issue about the Chola for CHAP doctors. Thank you.
Okay. Thank you so much. If I could just come in, Jayanti, for a second and invite Samta Rai, who is an activist based in Patna. And I would like to have a sort of say something about the work they have been doing. Samta ji, aap aiye. Is she here?
Samta is here, and I've asked you to unmute Samta. You can just, great, I think you accepted it.
सभी को नमस्कार। जैसा कि रश्मि जी ने बताया कि पटना में हम रहते हैं और एक कल्चरल एक्टिविस्ट हैं, जिस ग्रुप का नाम है कोरस, जो खास तौर से महिलाओं के प्रश्नों को कल्चरली कैंपेन के रूप में वो काम करता है। और अभी इस दौर में वो कोविड पैंडेमिक का जो पूरा माहौल है, इसमें वो काम कर रहा है लोगों के बीच। आवाज आ रही है क्या?
हाँ, आ रही। आप बोल दे जल्दी से, फिर मैं ट्रांसलेट।
जी। तो हम लोग अभी कोविड पैंडेमिक की जो स्थिति है, उस बीच में एक रिलीफ वर्क हम लोग का चल रहा है, जिसमें ऑल इंडिया स्टूडेंट एसोसिएशन, RYA और CPIML के एक्टिविस्ट इसमें लगकर काम कर रहे हैं। हम लोगों ने एक हेल्थ सेंटर भी शुरू किया है पिछले 1 महीने से, जिसमें कि बेड्स अवेलेबल हैं कि नहीं, ऑक्सीजन मिल रहा है कि नहीं, जो लोग सारे लोग जो घर में कोविड पेशेंट हो गए हैं उनको दवाई पहुंचाना, खाना पहुंचाना, इन सारी स्थितियों में इस बीच में लॉकडाउन भी लगा है। और लॉकडाउन में जो रोज के कमाने वाले लोग हैं, जो बहुत मुश्किल से अपना घर चला पाते थे, 2 वक्त का खाना खा पाते थे, उन लोगों की स्थिति भुखमरी की हो गई है। और इसी बीच हम लोगों ने लोगों के बीच राशन एक बांटने का काम किया है, जिसमें कुछ चावल, दाल, सब्जी वगैरह, उनको आटा वगैरह दिया जा सके। बहुत ही खराब स्थिति है और इस काम को करते हुए ये देखा जा रहा है कि पूरा जो सिस्टम है, मतलब सरकार लग रहा है कहीं है ही नहीं, सिस्टम कहीं है ही नहीं, और सारा कुछ लोगों के भरोसे छोड़ दिया गया है। लॉकडाउन बिहार में लगा है, रोज ये दिखाया जा रहा है कि संक्रमण दर कम हो रहा है, लेकिन ये रियलिटी नहीं है, ये इसको छुपाया जा रहा है। ये गांव-गांव में फैल चुका है। आप लोग देख ही रहे हैं कि चारों तरफ लाशें ही लाशें हैं। ऑक्सीजन एक ऐसी चीज है जो हवा में है, लेकिन वो तक मिलना हम लोगों को मुश्किल हो गया है, आम लोगों को भी। तो इस स्थिति में हम लोग कोशिश कर रहे हैं लोगों के मदद करने की, और लगातार हम लोग लोगों के बीच में जा भी रहे हैं, काम भी कर रहे हैं। और ऐसे समय में जो भी समाज के जिम्मेदार लोग हैं, क्योंकि सरकार ने तो छोड़ दिया है, उसने मतलब कहा जाए जो आत्मनिर्भरता का नारा उन लोगों ने दिया था, वो जीने मरने के लिए सरकार ने छोड़ दिया है इस नारे के साथ। और जो भी स्थिति है उसमें समाज के जो भी जिम्मेदार लोग हैं वो आगे आ भी रहे हैं और आ भी रहे हैं। और हमारी पूरे इस कैंपेन से यही लग रहा है कि जितने लोग इसमें साथ देंगे, हम उतने लोगों तक मदद पहुंचा पाएंगे। ये यहाँ पर उपस्थित सारे लोगों से ये अपील भी है, हम लोगों से जो भी हो रहा है हम लोग इकट्ठा करके और लोगों में मदद पहुंचाने की कोशिश कर रहे हैं। ऑक्सीजन, खास तौर से हम ये कहेंगे कि ऑक्सीजन जैसी चीज जो कि कुछ मान लीजिए एक मिडिल क्लास हॉस्पिटल के लिए परेशान है, उनकी भी डेथ हो रही है, लेकिन जो गांव में है या जो बस्तियों में है, शहर के जो स्लम्स में है, मतलब उनको पता ही नहीं कि वो कैसे अवेलेबल होगा। हम लोग देख भी रहे हैं, घर में रहो, सुरक्षित रहो की जगह वो लोग सड़कों पर हैं। तो मेरा यही कहना है इसमें कि जरूर सारी दिक्कतों के बावजूद हम लोगों को जरूर सामने आकर जितना संभव हो सके जरूर मदद करनी चाहिए। और आप और हम सब साथ होंगे तो भुखमरी की स्थिति जरूर वो भी खत्म होगी। वो कोरोना से के साथ साथ वो भी एक बहुत भयानक स्थिति भुखमरी की भी आ गई है। शुक्रिया।
अगर चैट में आप अपना कोई कांटेक्ट डाल दें तो आपसे लोग डायरेक्ट संपर्क कर सकते हैं।
जी मैं chat में डाल दूँगी
करेंगे. Okay, thank you, Samta. For those who don't know Hindi, I will just sort of quickly translate and in a summary fashion. Samta is a cultural activist who works with this group called Chorus, which is based in Patna. And she was talking about on the groundwork that they're having to do, because it's a situation not just that is a medical emergency, but also there is widespread scarcity of food and of basic necessities. And they are fighting on several sort of directions. They have set up a health center that connects them with hospitals, and as well as they are distributing food. And what she is saying is that it is far more widespread than any official is admitting to. So what we also plan to do is include a transcript of the talks and contributions which were in Hindi when we circulate the recording. Are we heading towards wrapping things up, Jayanti?
We have two more hands up. I wonder if we can ask them to share their comments as briefly as possible. So first, Shavilak Mishra, and then Abe Mohanja.
Shavilak Mishra, please ask your question.
You need to unmute yourself, please, Shavilak.
Yes, please unmute.
Okay, maybe.
We may have lost you, although it appears you're still here.
Maybe we can go to Abhay first.
Yeah.
Yeah. Hello, Abhay. Please unmute.
Hi, Subir. Can you hear me?
Yes, we can.
Yeah, I'd just like to make two quick points. One is about the quacks, the Chola Chap doctors. In the bag full of inventory, they had things like paracetamol, painkillers, and Dexona, that is cortisone, and a few other things. Now, with the media messaging and the huge outcry for oxygen, my sources in the remote parts of Champaran tell me that few enterprising ones have also been able to get oxygen, whereas people in privately in home quarantine this time they have not been able to get oxygen. In the last first wave, many people were able to get oxygen at their homes, but this time that has been elusive. Secondly, living here on the border of Nepal, my friends in Nepal say that India, despite shortcomings, despite the outcry, they are still battling with the pandemic. We are worse off, and we have been able to vaccinate just 2% of our population, and it is their villages are remote in the hills, in the Tarai. They are unreachable, and the pandemic is as bad in Nepal as it is in India. But my friends there say that they are in great need of help. Thank you.
Thank you so much, Abhay, for bringing in the Nepal angle, because of course, from what we are seeing, they're having massive problems of the same sort.
Lalka wala bag or charge?
Just 2% have been vaccinated there so far.
Exactly. Okay, is Shavilak Mishra here?
He doesn't seem to be able to unmute, but I wonder if we should, this is the absolutely final, unfortunately, question. There is...
He has come. Hello there, Shavilak, can you unmute?
No, he's present, Subir, but he's not able to unmute because I've been requesting it all this time.
But we can't hear you. There's one. Hello,
yes.
Hani Mangat, can you please ask your question briefly? Hello.
Hi, good evening to you all. I have no any question. I just want to congratulate and appreciate the effort that have been taken by all the people. They have from around the globe having a concern about the current situation of the pandemic situation. And we know that the current government has failed totally, but we need to look into the future and find the solution, not to happen it again. So
thank you so much.
Thank you once again. Thank you once again. Yeah.
Thank you so much for that positive note.
Thank you.
Okay.
Yes, I wonder if we can move to concluding comments from Subir, and we also want to explain very briefly why, regrettably, we couldn't have two of the speakers join us.
Thank you very much, Jayanti, and it has been, as I can't say it's been a pleasure, because this is such a harrowing situation that much of the world has gone through, and currently India is going through, and it is just rolling from one center of massive infection and build-up of deaths to the other. So I don't want to make things appear very dire, but at the same time, it is hard really to be extremely positive at this point. I'd like to thank the people at Warwick University, the Warwick Interdisciplinary Center for International Development, with whom the SOAS Department of Development Studies collaborated in putting this thing together. There were a lot of PhD students and staff at Warwick who have done the bulk of the organizing here. Wrapping up is not an easy thing to do in a public meeting like this, but can I just suggest that there are 3 or 4 things people should think about as things to take from here. One of them is the question of
you're muted.
Okay, yes. The first is that to try and comprehend the scope and scale of the catastrophe. And as Murad said early on, we really have to think in terms of what the numbers are telling us and what the numbers are not telling us, and how much the not telling of the numbers is part and parcel of the problem that needs to be addressed and to be solved. Also, we saw Ravinder talk about the fact that a lot of the response has become very much of a spectacle. And it's not so much that the government is missing, it is actually actively creating a scenario, both in terms of the repression of any kind of dissent, but also in terms of hiding. And in fact, some of us have been thinking about how much hiding data is now a very important part of governance, where you just cannot hold government accountable because the data is not there. I want to thank also Suraj and Vishnu in terms of bringing into the discussion very grounded accounts of what is going on in the areas in which they are traveling and the areas in which they are living. I'd likewise also want to thank Mathew and Rajendra, because they were able to provide some glimmer of hope of how one state and one district, particularly a district that is quite poor, has been able, via ingenuity and by, as he said, jugaad, to have a response which is far better than the responses in districts which are far better off. And in the case of Kerala, what a long practice of handing development over to local organizations, and to think of it not as a charity, which still is the case for much of India, but as a right of people, can create institutions and organizations which are people oriented and which they have ownership of, which has been able to create a fantastic response. Also remember that Kerala is one of the few states that, at the risk of sounding as if they had very high number of cases, did not fudge the data. It put the data out, it did the testing out, it put out the cases, information about the cases. And it is a very good example of how having that information is essential to providing and creating a solid response, and to be able to arrest and to also anticipate the waves that are coming through. In addition to this, I really appreciated Reika Sonavani's account of
Nikita Sonavani.
Yes, I liked it, in terms of the account that she provided of the spread within prisons, and to think of politics more broadly speaking. Now, as you know, this is not just a public meeting with people speaking. There is a very important fundraising component to this meeting as well. And we have been posting that information in the chat on a rolling basis. So can I now just invite, is it Rohini who's going to be speaking, and the members of the organizing team who will be addressing the question of fundraisers. So over to you, please.
Thank you so much. As most of you have noticed, we've been posting the details of our fundraiser in the chat. To give you a very, very quick overview, we've selected 5 organizations that are working specifically in rural areas with extremely vulnerable communities. And we have spoken to the organizations on the ground, made sure we have all the necessary regulatory clearance. We zeroed in on these organizations because we genuinely believe that rural fundraising should perhaps be the focus of the hour. The newsletter contains details of all our fundraiser along with the link. In addition to that, for those of you who might want to contribute in INR and have Indian bank accounts, we've put a list of organizations that can only take contribution in INR from Indian bank accounts because we're not able to fundraise for them. So if you have any questions, you can ask us here. We have our email IDs in the newsletter. You can reach out to us there. But we would encourage you to share the fundraiser. They are contributing directly to assisting vulnerable communities or to contribute to the ones that we can't fundraise for. And thank you so much.
Are there any questions that anyone has for Rohini? You can post them in the chat, or Rohini, your details are there in the link you have provided, right?
Yes, the newsletter contains our email ID, and if anybody wants to reach out through the GoFundMe link, it'll invariably reach us anyway. So any questions on the fundraisers, we are available to answer all of them.
Okay, as we draw to a close, I just want to say a couple of things. One is that with profound regret, I want to say that we could not have Meena Kandasamy on the meeting, on the program. She just faced a bereavement this morning due to COVID, and therefore was unable to join. And Reika Surya, who I had hoped would bring us to our Iqbal Bano moment of instilling a spirit of resistance to what we are facing. Her internet just gave up. She came in and out of the meeting several times, but what she has promised is that she will record the 2 nazms that she had specially composed for this meeting, and that we hope to add to the recording and share with everyone who had signed up for this public meeting. So those are our 2 regrets. And then the other thing to say is that we have recorded this meeting, and we will be editing and sharing it with all of the people who had registered, as well as on our social media. So do be on the lookout for that, and stay in touch. We will also be getting in touch with you to promote the Warwick Emergency COVID Relief Fundraiser. And again, all the details of it are in the link, and we will be sharing it with everyone who registered. Jayanti, is there anything else to add before we do a final thanks to everyone?
I think you've covered everything. I think just thanks to all of the participants, which I think you can say more eloquently than me.
Yes, thank you to each and every speaker who came to us from different parts of the world, including from places where internet connectivity was a real issue. Thanks to everybody who joined the meeting, who participated. We know that this is a really, really difficult time. And we did start off by thinking, what should we do? And instinctively, we thought it would be a good thing to bring people together. Of course, keeping social distance in mind, it worked out that, we could do this as an online meeting. But we hope that we will keep the conversation going, that we will stay connected, and that we will help each other out in the weeks and months to come. We think that this is going to be a long haul in terms of rebuilding, everything that has been, devastated and that is lying in ruins, whether it is the healthcare infrastructure or whether it is social bonds and communities. So stay in touch, and thank you once again for taking time out to join us.